Hello, everyone. Good morning, everybody. I'm Priyanjali from Prostate Wellbeing Team. I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic, which is renal calculi. Renal calculi, or kidney stones, are hard, pebble like pieces of mineral that form in one or both your kidneys when high levels of certain minerals are in your urine. Kidney stones vary in size and shape. They may be as small as a grain of sand or as large as a pea. Rarely, some kidney stones are big as golf balls. If you have symptoms of kidney stones, including severe pain or bleeding, seek care right away. A doctor, such as a urologist, can treat any pain and prevent further problems such as urinary tract infection, commonly known as UTI. To throw more light on the subject and guide us on what's right for diagnosis and treatment of renal calculi, today we have with us renowned urologist Dr. Rahul Sharma. MBBS, DNB surgery. He has a rich experience and hands on expertise in urology, BPH, and stone management. He is currently practicing at Rudrapur as general and laparoscopic surgeon. Dr. Rahul Sharma has rich experience in the field of urology and carries out the renal calculi diagnosis and treatments with utmost precision and efficiency, ensuring that the patient health is in safe hands. Over to you, doctor. We welcome you to today's platform. Our first question, doctor, for you would be, what are kidney stones?
Kidney stones are basically mineral deposits that develop in the kidneys because of a variety of reasons. Uh, the most common of those reasons might be dietary factors as well as hereditary factors. So, the dietary factors, which is seen most commonly, is a lack of hydration, that is, a low intake of liquids, as well as eating a lot of animal protein. Along with having a lot of refined sugar. So these are the most common dietary factors that lead to the formation of kidney stones. The other thing is there is a hereditary aspect to it as well. Uh, so if you have a hereditary proclivity to develop kidney stones, as in your parents or your first degree relatives have those kidney stones, you are at a higher risk to develop kidney stones. And once you develop the stones throughout your life, the risk of developing recurrent stones increases to about 50%. That is, even in patients that we treat for kidney stones, at least half of them usually return with recurrent stones.
So, doctor, we know that the main part of any disease is identifying the disease. So, how do we identify kidney stones? What are the symptoms of it?
Kidney stones are identified mm, on the basis of clinical examination and then certain diagnostic tests, which could be urine examination, blood examination, as well as imaging studies. Imaging studies such as ultrasound and CT scans. So, firstly, we come to the clinical features, that is the symptoms. So, the most common symptom with kidney stones is pain, pain that radiates mm, from the groin towards the back. Uh, it's present on both the flanks. I mean, one or both the flanks, depending on how many stones you have and which sides are involved. So the first symptom is the pain. The second thing is that you might have blood in your urine because of the stones. Uh, you can develop a superimposed urinary tract infection because of the stone, which might lead to fever. Usually, it's fever with chills, and because of the pain, you might have nausea and vomiting. Apart from that, there is sometimes burning micturition, that is a burning sensation while you relieve yourself, while you urinate. So those are the symptoms that are most commonly seen. Then we come to the investigation. So most commonly, what investigations we do are imaging studies. If we have a suspicion that the patient has kidney stones, we firstly ask the patient to get an ultrasound. The ultrasound of the abdomen is quite sensitive in detecting kidney stones as well as ureteric stones. Ureters are tubes that connect your kidney to the urinary bladder. So the kidney stones may pass into the ureter, which might even cause more pain. So ultrasounds are quite sensitive to detect kidney stones, but sometimes they may not be able to detect the kidney stones. In which case, we move on to CT scans. In CT scans are the gold standards for the investigation of kidney stones. We come to know the exact size of the stone, the location, as well as whether any back pressure is having any adverse effect on the kidneys. Apart from that, urinary microscopic examination may reveal what kind of kidney stone we have. Firstly, they might tell you if there is any blood in the urine, if there is any infection, and based on the type of crystals that might be present in the urine, we can diagnose what type of kidney stone it is.
Right. Moving ahead with the next question, doctor. So, do kidney stones form in one kidney or it can form in both the kidneys?
It can happen either in one or both kidneys. Uh, there is no hard and fast rule that it will happen in one and not the other. Usually, we see, at least in early cases, that it happens in one kidney. If it is ignored, it might occur in the other kidney as well because the risk factors are mostly systemic. They are not localized risk factors. In cases of stones that form because of infections, that might happen in one kidney and not the other.
Right. So, doctor, again, moving back to the same point, the causes of kidney stones, you mentioned that dietary can be one of the major causes, but can also drinking less water and urinating less be one of the major causes as well?
Yes, yes, absolutely. That is one of the most common causes for developing kidney stones. Having less water means your urine is going to be, just in layman's terms, your urine is going to be more concentrated. If it is more
Right.
concentrated, it means there will be more minerals in the urine. More minerals in a smaller quantity of urine will allow more crystallization of those minerals, and that will lead to formation of stones. So that is the most important dietary factor in cases of kidney stones.
Right. Doctor, we also meet patients who are okay with the treatment, but when we talk about surgery, we tend to see patients are mostly scared of it. So, does all kidney stones require surgery?
No, all okay. This is a all kidney stones do not require surgery. The requirement of surgery is based on the size of the stone, most commonly, and the location of the stone. So, 4 mm or less, if the size of the stone is 4 mm or less, about 90% of those stones will pass without surgical intervention. 4 to 6 mm, it's about 50 to 60% of those stones will pass without surgical intervention. More than 6 mm, more than 6 mm, the stones will more likely get impacted in one of the ureters rather than pass by itself. So, in those cases, surgical intervention is more commonly required.
Right. Uh, Doctor, again, moving back to the same point, water, as we know that it is one of the major causes of formation of kidney stones. How much water should one intake in a normal weather condition? What is the normal intake of water?
So, normally we advise patients to take about 2 to 2.5 liters of water per 24 hours. That is ideal uh, in a lot of scenarios, not just for kidney stones, but apart from that, for your gut health, for your general health as well. But yes, for kidney stones, at least 2 to 2.5 liters of water a day is recommended. Apart from that, yes, there are some other dietary restrictions that we recommend for patients who already have kidney stones or for patients that we have treated for kidney stones so that the recurrence of kidney stones is prevented. So those might be to have less animal proteins, to decrease sodium intake, that is salt, then to decrease intake of refined sugars, decrease intake of chocolates, nuts, as well as oxalate containing food, that is mainly leafy vegetables like spinach, uh, and cauliflowers and brinjals. So these are the things that we recommend to the patients.
Right. Doctor, again, speaking about the basic things, let's talk very basic today. Uh, we now know how much water to take. What about salt? How much salt is recommended for a person
So,
generally?
salt generally we recommend. So, in nephrology, they say 1 spoon less, as in whatever your salt intake is, it
Hmm.
should be at least decreased by 1 spoon in the next 10 to 15 days. And ideally, we would say about 1 to 1.5 spoons of salt is more than enough. You don't need really more than that, and in the general population.
Speaking about protein, doctor, protein has
Yeah.
also become very hype today. People are diet conscious, people are physique conscious,
Yeah.
and they tend to take a lot of protein. We have seen people skipping their meals, and in place of their meals, they just take protein shake.
Yeah.
How healthy is that, and should they keep on doing that?
So, protein shakes are a dietary supplement. They are
Hmm.
not a dietary replacement. This should be understood by everyone.
Right.
Just taking protein and large amounts of protein is not good for you.
Hmm.
Our body needs 1 gram per kg per day. As in, if you are, if say I am 70 or 75 kilograms of weight, I need about 70 to 75 grams of protein in a day. More than that, it will put a strain on your kidneys, and yes, it might lead to development of kidney stones. And we do see that in a lot of patients who are taking excessive amounts of protein supplements, which is not technically recommended. To complete your protein requirement for the day, you need 1 gram per kg per day. So that depends on your weight. It varies with everyone. More than that is going to cause more harm than good.
Right. Well, I believe all the fitness conscious people who are watching us right now, this is something you need to keep in your mind. Uh, we know that diet plays a very important role in fitness, but please mark your protein count whenever you're taking it. Please make sure that that much is necessary for you. Moving ahead, doctor, there are many myths related to kidney stones. We have heard people saying कि बहुत ज्यादा बियर पीने से शायद किडनी स्टोन निकल जाएगा बॉडी से. हाउ ट्रू इज दैट, एंड इज इट इवन ट्रू?
No, so that is not something we recommend. Uh, uh, there is a myth that it is true. It happens because alcohol induces diuresis. That is, alcohol causes you to pass more urine as compared to when you're not having it. So the myth is that when you pass more urine, it will pass your kidney stones. But alcohol by itself can have detrimental effects, not just to your kidneys, but to your livers, to your stomach lining, and of course the various effects of intoxication, which can lead to um, any kind of unwanted results. So that is not
Right.
something we recommend at all.
Right. वेल आई बिलीव यू हैव हर्ड दैट. जो भी जितने भी व्यूअर्स हैं जो ये सोच रहे हैं कि बियर पी के किडनी स्टोन जा सकता है आपके बॉडी से, वेल दैट्स नॉट द राइट वे. उसका एक बहुत ही अच्छा सब्स्टिट्यूट है, जो हमारे जीवन का सोर्स है, विच इज वाटर.
Water,
Trust
yeah.
that blindly, and I believe बहुत easily आपके जीवन से सारे समस्याएं दूर हो सकती है. Speaking about water, doctor, we are talking about kidney stones today, but we also know that just having water can release maximum of toxins from your body. It's a natural detox having a proper amount of water. Also आप बहुत सारी बीमारियों से भी दूर रहते हैं. How important is having water on it on this time, especially when people are so much into work, they tend to forget their water timing. They tend to avoid the duration, in how much duration they should have the water, how important is to have to water. Also, how much duration should they maintain in having the window gap, how much should that be? We see people कि हमने कहा कि 2.5 लीटर पानी आप पीजिए, they tend to have 2 liters at once. So is
Yeah.
that safe?
No, so that is the thing that we recommend, that I also recommend to my patients. It's not about just drinking 1 liter of water at a time or
Mm,
2 liters of water at a time. That, yes, your water intake you're still taking, but that's going to cause a lot of discomfort. You don't need to do
right.
that. You don't need to do that. So what happens is, 1 glass of water is considered to be about 250 ml on an average. So about 10 glasses of water throughout the day. In 24 hours, about 10 glasses of water will suffice for your water intake. Now, ideally, what we tell patients is to have water when you're thirsty. But if you are not completing your water intake, then you need to have some sort of reminder that is going to remind you every hour or every 2 hours to have at least a glass of water, because you're going to be awake for maybe 12, maybe 14 hours, maybe 16 hours, right? So you're not going to be able to drink throughout the day. It is within those 12 and 16 hours that you're going to complete your water intake. Now, that water intake should be completed in parts. It doesn't need to be taken at one go, right? So you have 1 glass of water even every hour or every hour and a half to 2 hours. That is sufficient. You don't need to do more than that.
Right, right. Doctor, speaking about another topic which we have just highlighted about, reoccurrence of kidney stones. Why does it happen, and how can one stop it from happening again and again?
So recurrence of kidney stones is something that is very problematic, and we see that in a lot of patients, whether they undergo conservative management, as in whether we treat them with medicines and the stones are expelled, or whether they are surgically managed and the stones are removed. Once your kidney develops the proclivity to produce stones, it's going to have a higher chance of developing stones than someone who has never had a kidney stone. So, in a patient who has had a kidney stone, even if it has been removed, they have about a 50% higher chance to develop kidney stones as compared to a patient who has never had a kidney stone. Now,
Mm,
the uh, the advice that we give to patients to prevent the recurrence of kidney stones, firstly, is of course your water intake. You have to have about 2.5 liters of water a day. Ideally, what we read in textbooks is that 2.5 to 3 liters of urine production in 24 hours is ideal for prevention of kidney stones. Now, that means if you are having 2.5 to 3 liters of water a day, you should have about that much urine production. Now, so first thing is that. The second thing is the other dietary restrictions that I mentioned. A reduction in animal protein intake. So animal protein intake more than 32 grams per day, sorry, 52 grams per day for anyone is will cause a high likelihood of kidney stones. Then having proper calcium intake. Proper calcium intake means at least more than 30 mg per day. Now that can be through your diet, through calcium supplements. That depends. Then to avoid stones, to avoid diets that are high in oxalate, such as like I mentioned, nuts, chocolates, green leafy vegetables, as well as brinjals. Then to avoid a lot of tea and coffee intake, which also leads to formation of kidney stones. And in case of any pain or any burning sensation in your while urinating, you need to get yourself checked quickly so that the stones do not increase in size and they can be managed medically rather than surgically.
Right. Uh, well, viewers, you need to make uh, a point, a note of something which doctor has just mentioned. Uh, well, people who are already worried कि यार चाय के बिना कॉफी के बिना कैसे रहेंगे, we have so many people who are tea addicts. We live in
Yeah,
India, come on.
that is the thing.
We love our tea, we love our coffee, but having excessive of anything is not good. You should, balance it with your diet. Have a balanced diet, have everything, but जितना आपको ज़रूरत है उतना ही. Excessive of anything is not good. Doctor, again, being in the Indian society, we know how much we love our घरेलू नुस्खे. We love our home remedies. So, is there any home remedies for kidney stones as well? I personally have met people in my life who believes that some लीव्स एक्सट्रैक्ट और कुछ फलों के जूस, कुछ पत्तों के जूस पीने से शायद किडनी स्टोन चला जाए. Still date, on today's date also, there are many people who lives in the village areas or the rural areas. They do not go to the hospitals for any kind of disease or any kind of issues in their body. They only believe in their home remedies. What do you have to say to those people? And is it safe?
Yes. So it depends on what you are ingesting. The best home remedy is water, right? So having a lot of water is going to help you.
Mm,
Now,
mm,
the other what you can consider home remedy is cranberry juice. Cranberry juice is known to prevent recurrence, and it helps in treating UTIs. It helps in removal of kidney stones as well. Apart from that, now it depends on what people, the food fat that is prevalent, but it depends on what people are ingesting. Some might be just useless, some might actually harm you. So I would say
mm.
at least consult someone who is knowledgeable in this aspect of life.
Right, right. Also, I think one of the major reason is uh, जो चीज आपको 2 दिन में ठीक कर सकता है उसके लिए आप 2 महीना क्यों लगाएंगे? Why do you have to tolerate the
Actually,
pain for two
yes.
months when it can be cured in 2 days? Our experts are available always around you. Always suggest the expert before doing anything to your body. Your body's very, very much important. It's like a gold which you should preserve and you should take care of through your entire life. Guys, please इसको हल्के में मत लीजिए. We always suggest our patients, our viewers that there was a time कि टेक्नोलॉजीज नहीं थे आपको मदद करने के लिए, कोई भी प्रॉब्लम के लिए, कोई भी सोल्यूशन के लिए. देयर वर नॉट पीपल अराउंड, बट एट टुडेज डेट चीजें इतनी आसान हो गई है. हमारे एक्सपर्ट्स मौजूद है, टेक्नोलॉजीज इतने एडवांस हो गए हैं. सो व्हाई ट्रबल योर बॉडी फॉर दैट? प्लीज प्लीज आसान सोल्यूशन ढूंढिए और एक्सपर्ट के पास जाए. मूविंग अहेड डॉक्टर, आई कैन सी सम क्वेश्चंस कमिंग फ्रॉम द व्यूअर्स. द फर्स्ट क्वेश्चन कम्स फ्रॉम रोहित जॉन, जो पूछते हैं, हाउ कैन आई प्रिवेंट किडनी स्टोन्स?
I'm sorry, I got cut off. Could
Yes.
you repeat the
So the
question?
first question, doctor, comes from Rohit John. He asks, how can I prevent kidney stones?
See, if he has never had kidney stones, he doesn't need to worry so much. Like I said,
Mm,
the most important thing, if he maintains a good fluid intake and avoids an excess. Now, that is what we say, the dose makes the poison, right? So anything in excess, sugars in excess, proteins in excess, might lead to a formation of kidney stones. So I would suggest have a lot of water. 10 glasses of water a day, like it has been, it's very common knowledge nowadays. So 10 glasses of water a day is sufficient throughout the day. If you can have 10 glasses of water, most likely you will not develop kidney stones. Unless you've had kidney stones in the past, then you might have to take further precautions like avoiding animal proteins, avoiding a lot of sweet food, and certain oxalate containing foods such as, like I mentioned before, such as leafy vegetables, nuts, chocolates, etc.
right. Doctor, also tell us what are the treatment options available currently for kidney stones?
Yes. So Like I mentioned, the treatment depends on the size of the kidney stone, whether it is impacted somewhere and causing harm to the kidney itself. So first we try to for smaller stones, anything less than 6 to 7 mm, we try to treat the patient medically, as in we give some medicines, we ask the patient to drink a lot of water, and we hope that the kidney stone will be expelled with that. Now, if that does not happen, then there are surgical interventions. Before surgical interventions, also there is ESWL, which is lithotripsy based on shock waves. So that is a machine that delivers shock waves from outside your body to the kidney stone, which helps to break down the stone. And it might, if the fragments are smaller, they will pass through the urine. If the kidney stone is very large, so something that we call staghorn calculi, which is very large inside your kidney, it will cause a lot of detrimental effect to your kidneys. In that case, we need to have a surgical intervention. The surgical intervention can be an open surgery, which is not very prevalent these days. Now, what we have is something called PCNL, percutaneous nephrolithotomy, uh, which can be done through a small incision in your flank. And apart from that, then if there are smaller stones in that are impacted in your ureter, as in the tube that connects the kidney to the bladder, then you don't even need an incision. There is something called a ureteroscope. A ureteroscope, as in it goes in through the urethra, it goes into the ureter, and we pull the stones out through the urethra itself, in which there is no incision. And there is not a lot of time that you need to stay admitted in the hospital as well. So, those are very advantageous to patients who require them. Um, Apart from that, open surgery now is not really preferred for kidney stones. Most of the kidney stones are treated with minimally accessible surgery, as well as endoscopic surgery. So we have come leaps and bounds in that regard. So treatment now is a lot less painful and a lot less morbid than it was, say, a decade or so ago.
Right, right. Doctor, we know that exercise also plays a very important role in our day-to-day lifestyle. So, what about kidney patients? Do we suggest them to have a regular lifestyle or regular
Yes,
exercise
yes,
life?
absolutely.
And what about after treating? Are they recommended that?
Yes, yes, absolutely. So that is another advantage of these minimally accessible surgeries or endoscopic surgeries is that you are not bed bound for a very long time, maybe a week, 10 days. After that, you can get back to your normal physical exercise. And in about 4 to 5 weeks, you can even start strenuous physical exercise, as in people who work out or lift weights or run. All of that is possible now. It doesn't take a very long time to recover from those surgeries. And
Right.
absolutely, exercise is very essential. Obesity is one of the causes of firstly diabetes, hypertension, and subsequently kidney disease, as well as formation of stones. Obesity is an independent risk factor for the formation of stones.
Hmm, hmm,
So,
hmm.
dietary factors and exercise both are very important.
Right, right. Uh, Again, exercise is something which will relieve you from most of the problems in your body.
Yes,
Water, exercise, and another main thing which doctor has focused on today is sugar, intake of sugar. Doctor, we know that intake of sugar, if increases in any part of your body, it can cause a lot of issue. If in blood, it can cause diabetes. You have already mentioned about kidney stones. There are many such things. So, what about sugar lovers who love taking sugars? What do we suggest them if they
no,
can avoid the?
unless unless you're diabetic, you don't need to avoid sugars completely.
Hmm.
But again, you need to temper your sugar intake. If you have very excessive amounts of sugar, it's going to be bad for you. Sugars are carbohydrates. Now, carbohydrates is basically your energy source for your body, right? Now,
Right.
if you take more sugars than your body needs, it's going to harmfully affect you in the sense
Hmm.
that firstly, it will cause weight gain, right? Those sugars will be converted to fats and it will cause weight gain. Secondly, it is a risk factor for diabetes. Once you have diabetes or obesity, you are more prone to develop hypertension. Now, diabetes and hypertension by themselves, they are anyway dangerous. But apart from that, the sequelae, the effects that they have further on the body is even worse. They're going to affect
Hmm.
your eyes, they're going to affect your kidneys, they're going to affect your liver, they're going to affect the arteries in your heart or even in your limbs. So, tempering sugar intake is essential. Having excessive amounts of sugar is not good. It's going to be harmful for your body, for anyone. For diabetics, so anyway, they're going to avoid sugar. They have to avoid sugar if they want to
Right.
maintain their blood sugar levels. But even for non-diabetics, having excessive amounts of sugar is not helpful at all. It's going to harm.
So, is there any alternative for refined sugar, doctor?
Yes, there is. Mm, as which is commonly seen, there is aspartame, which is usually seen in the sugar free that you have, sugar
Right.
free
Right.
sachets as well as pellets that you have, that usually contains aspartame. Then there are some other substitutes like xylitol, which have relatively less glycemic index, as in they increase your blood sugar but not to the same level. I would say rather than substituting for a normal person, rather than substituting sugar for something else and having the same amount of sweet foods, I would say curb
Hmm.
it. To try to avoid having
Hmm.
an excessive amount. Again, I'm not saying that you have to completely give up sugars. Sugars
Hmm.
are an essential part of the diet for a normal person, but to curb an excessive amount of sugar intake is essential.
Right. Doctor, we also meet dietitians who suggests alternating sugar with fruits. And now, on today's date, we have heard that fruits have fructose. So, खाए तो क्या खाए सबका हालत एकदम खराब हो जा रहा है. Everybody is so much worried कि what to eat and what not to eat, what to avoid. People are so confused कि now people are also thinking before having fruits. So, how to take fruits?
No, no, no,
We
no.
have also met people who says कि fruits को solid form में खाना चाहिए. You cannot just have a juice of it and you cannot have it like that. So what do you suggest?
Yes, there is some truth to that. Now, sweet fruits have fructose, which is
Hmm,
a sugar, which is a simple sugar.
hmm,
Uh,
hmm,
Apart from that, the other thing that you said, the juice. Now, there is some evidence to suggest that having whole fruits is
hmm,
better than having fruit juices. That's
right.
not to say that fruit juices are going to be harmful for a normal
Hmm,
person, but uh, nutrition wise, yes, whole fruits will be better than ingesting fruit juices. That is one thing. Now, fructose is a sugar, and like I said, having an excessive amount of anything, if you take the most healthy thing in the world, having an excessive amount of that is also going to be harmful. So you
hmm,
don't need to worry about which fruit should I have, which fruit should I not have. If you're a normal person, if you're not a diabetic, then having fruits, a moderate amount of fruits is very good for you. Because apart from fructose, they contain fiber, they contain essential minerals, they contain vitamins, which your body needs. So some fructose along with that is not going to harm you so much. Now,
Mm,
if you're going to have like a kilogram of mangoes, yes, that's going to harm you because that's going to
mm,
increase your blood sugar levels. But having a couple of mangoes every day is also not going to harm you that much, unless you're diabetic. Of course. A normal person, I'm talking about a
right.
normal person. Yeah.
Right. Well, that was the expert advice for you all, for all the fruit lovers, and for all the people who are worried ki fruits khaye ki nahi. This was for you all.
You
Moving
should
ahead,
have to.
doctor, to the next question, which comes from Yash Namdev, who asks, Doctor, what should I drink to reduce the risk?
Reduce the risk of
Kidney
renal
stone.
calculi. Well,
Yes.
water, best of all. You drink water. Like I have been saying, and I will continue to say, like I say to my patients and anyone who asks here as well, 2.5 to 3 liters of water a day will, in most cases, prevent kidney stones. You will most
Right.
likely not have kidney stones if you are having that much water a day. Now, for people who have strenuous exercise, who are sweating a lot because of the heat
Mm-hmm.
that we're having. So for them, I would suggest to have even more. And yes, they will feel more thirsty. They will most likely take more water. So, uh, especially in the heat, we might increase the intake of water to 3.5 liters a day. That is going to help. And that's going to prevent the formation of kidney
Right.
stones.
Right. So the source of life, water, and it is actually the source of life.
Great,
Don't
absolutely.
do not doubt it at all. It can heal you. It can cure you in every possible way. Doctor, the next question comes from Firoz Khan, who asks, can kidney stones dissolve on their own?
Kidney stones do not dissolve on their own, they will be expelled. Now,
Mm,
if your kidney stone, so what we call concretions are basically they are the size of sand particles. You know, they're less than 2 mm in size, less than 1 mm in size sometimes. So
mm,
those will pass on their own if you have sufficient water. You don't even need to take any other medication. Just sufficient water will help you pass. If you are having pain, if the patient is experiencing pain, then we give them some painkillers for a small duration so that it doesn't harm them either. But along with that, water is absolutely essential. Then uh, dissolving, they don't really dissolve. Once they have crystallized, they will either pass or they will get stuck. If they are small and you have a sufficient amount of water, they will pass. If they are very large, then surgical intervention might be your only choice.
right. Right. The next and the last question, doctor, comes from Ria Sathi, who asks, when can I see a doctor?
Okay.
So,
So,
which would be the
so right, the
yes,
symptoms that she's asking about. So,
yes, yes.
if you have pain on the side of your abdomen, okay,
Mm,
or on the back, or pain that is radiating towards your groin region, that most likely is the pain of a kidney stone or a ureteric stone. So you should see a doctor in that regard. Apart from that, the other symptoms that you might have are if you have an infection, you will have fever with chills. In cases of kidney stones, you might have some reddish urine. That is, sometimes it causes injury to the inside of the ducts that carry the urine, so which might lead to some bleeding or some blood
mm,
present in your urine. You might have a burning sensation when you pass urine. So any of these symptoms, you should see a doctor.
right. Well, these were all the questions from our viewers today. Doctor, we had a very, very interesting and a very informative session today. Before we take a leave, any take home message for our viewers who has watched us so far?
Take home message. I think you have already given that take home message that water, the source of all life. Please have sufficient amount of water. Again, you don't need to overdo it. You don't need to have 5 6 liters of water. That's going to harm you. But
Mm,
two 2 to 3 liters ideal. would be ideal for most people, unless if you have any kidney disease, please consult your doctor about water intake as well. But for normal people, I would suggest 2 to 3 liters of water. Even a little more in this heat is not going to harm you. So please, water is essential. Please maintain adequate amount of water intake, and you should not have a problem regarding kidney stone.
Right, right. Well, that was Dr. Rahul Sharma for us. Thank you so much, Doctor, for your valuable time. It has been a very informative session for our viewers today, and we look forward to many more such sessions in coming time. And thank you, viewers, for your excellent participation. For more information and updates, stay connected on our FB page, Prostate Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and stay healthy.
Thank you.